South African Medical Association. They say that it's in the best interest of health workers to receive a Johnson & Johnson COVID-19 booster shots before the predicted fourth wave. Now, recent data suggests that an additional shot can further boost immunity. I'm joined now by the South African Medical Association's chairperson, Dr. Angelique Coetzee. Dr. Coetzee, good to have you with us once again on the Daytime Update. So talk to us about the necessity of yet another shot for Johnson & Johnson. Our understanding that one shot for Johnson & Johnson was good enough, but clearly this does not seem to be the case.
So, yes, it's a very interesting situation. Our colleagues and doctors started to alert us already during the third phase, or the third wave, that some of our colleagues who had been vaccinated is getting sick again, albeit most of them had a mild to moderate disease and could have been treated at home, but one or two were severely ill after they have been vaccinated. And we then looked at, the complaints from our doctors and decided that it seems as if the efficacy is less and it's winding down. We brought it under the attention of Prof. Glenda Gray, as well as National Department of Health. And originally, National Department of Health said to us that we cannot look at the second dosage. There's no data that actually confirms that the efficacy is less after a few months. Prof. Gray was, however, told us that there's a nice, the third ensemble study, the data is going to come out that would confirm what we were already seeing under our colleagues, that a booster dosage for with Johnson & Johnson would be necessary. And so last week, those data was made available, showing us that if you get another shot of Johnson & Johnson 19 vaccines, especially when you get it, whether you call it a booster, whether you call it a second dose, it doesn't matter. If you get it 6 months after your first shot, that your antibody levels increased 9-fold 1 week after the booster. And then it continued to climb to about a 12-fold higher 4 weeks after the boost. So, and if you get it between 6 and 9 months, it's even better. So the real world, that was the largest real world evidence study that has been on vaccine effectiveness that has been done. And with this in mind, we then again spoke with National Department of Health, the acting DG, and alerting them that this is the new data, this is what is out there. And in the meantime, also what happened is when Johnson & Johnson got this new data, they approached SAHPRA for approval for a second boosted dosage of Johnson & Johnson. So that's also been approved this week by SAHPRA. So we are now only waiting for the signing off of the Minister for healthcare workers to get a second, as I've said, either whatever you want to call it, but the second shot of Johnson & Johnson. And we would like to see this, especially for those healthcare workers that has been vaccinated in February and March. That you should at least be 6 months post-vaccination from your first vaccine to, I think that you need to then to be eligible. And then also why we say that the healthcare workers, as we all expect a fourth wave, whether it will be December, whether it will be after December, the point is that you want to get as much as second dosages into your frontline healthcare workers' arms, as the protection would be of value to them, so that you don't get mild diseases going forward. Remember, even if it's a mild disease of COVID-19 breakthrough infections that you do get, it still means that those doctors and nurses must be off work for at least 2 weeks. And we simply doesn't have enough healthcare workers then to do the work. So we need to protect the people that's frontline workers ASAP.
Dr. Coetzee, the call now is for healthcare workers to get a second dose of Johnson & Johnson before the fourth wave, which is before November. But if the efficacy of the Johnson & Johnson vaccine wanes over time, surely this means